Hello everyone, welcome to Mentoria Medicina. Which type of joint is present at the arrow mark shown in the diagram is option B, secondary cartilage. As you all know, the arrow mark shows the pubic symphysis. In order to understand this question, we must understand the basics of joints and how are joints classified. Joints is an articulation between two or more bones or part of bones whether there is movement or not. Joints are classified into structural classification and functional classification. Structurally, they are classified based on whether the articulating surface of adjacent joint are directly connected by fibrous tissues like fibrous joint, or cartilaginous joint, or whether articulating surface contact each other within a fluid-filled cavity called a synovial joint. Now about functional classification. Functional classification is determined by amount of mobility between adjacent joints. There are three types: synarthrosis, amphiarthrosis, and diarthrosis. Synarthrosis is immovable joint, example suture joint. Amphiarthrosis is slightly movable, example intervertebral disc and pubic symphysis. Diarthrosis is freely movable, that is synovial joint. Cartilaginous and fibrous joint can either be synarthrosis or amphiarthrosis. In this question, we are dealing with structural classification. On this basis, it is classified into three, that is cartilaginous joint, fibrous joint, and synovial joint. First, we can discuss about cartilaginous joint. Cartilaginous joint is a joint that is covered by cartilage such as hyaline or fibrocartilage to allow movement between bones more than that of fibrous joint but less than that of synovial joint. Cartilaginous joints are divided into primary and secondary. Primary cartilaginous joint is also known as synchondrosis. Here no movements are possible. They are also called as temporary joints because in between two bones the hyaline cartilage is present. It is converted into a bone with age. Example is epiphyseal cartilage of growing bone or costochondral bone. The second type is secondary cartilaginous joint, also known as symphysis. Here bones are connected by a flat disc of white fibrocartilage and unossified throughout life, so they are called as permanent joints. Examples are joints in pubic symphysis. Here articular surfaces are bones covered by thin lamina of hyaline cartilage, and the hyaline cartilage are separated by fibrocartilage. Now let's look about fibrous joint and synovial joints. Fibrous joint form a type of articulation in which bones are connected by fibrous tissue, mainly collagen. There is minimal or no movement possible. They are classified into sutures as present in skull, syndesmosis as present in radio-ulnar joint, gomphosis as present in dento-alveolar joint. The third one is synovial joint. They are movable joint comprised of sac-like fibrous joint capsule, synovial cavity filled with synovial fluid, and a layer of articular cartilage. Now let's discuss about pubic symphysis. Pubic symphysis is a secondary cartilaginous joint. It is an amphiarthrosis joint that is slightly movable, made up of hyaline and fibrocartilage located between the left and the right pubic bones. It is located in front and below, that is anterior-inferior of urinary bladder. In normal adults, it can be moved roughly 2 mm, but it increases for women at the time of birth under the action of hormone relaxin. The fibrocartilage joint of pubic symphysis is fixed to its position by ligaments such as superior, inferior, anterior, and posterior pubic ligaments. They function to absorb shock during walking and allow delivery of a baby. Now let's discuss about interpubic disc. Interpubic disc is a disc of fibrocartilage that unites the pubic bones in pubic symphysis. Interpubic disc has a cavity in interior by absorption of fibrocartilage. This cavity is larger in females.
The muscle depicted in the picture was pectoralis major. The muscle is a fan-shaped muscle that is of convergent type. The pectoralis major muscle has a wide origin and a narrow insertion. The muscle has three heads: the clavicular head, the sternocostal head, and the short abdominal part. The clavicular head arises from the medial half of the clavicle. The sternocostal head arises from the manubrium and the sternal border up to 6th costal cartilage, and the short abdominal part arises from the aponeurosis of the abdominal external oblique muscle. The insertion is into the bilaminar tendon of lateral lip of bicipital groove of humerus. The muscle is called a twisted because at the insertion the muscle has the twisting nature, which means the lower inferior fibers of the muscle are inserted into the superior part of the tendon and the upper superior fibers of the muscle is inserted into the lower part of the tendon. Thus, it has a twisted nature at the point of insertion. The pectoralis major muscle is supplied by the lateral and medial pectoral nerves. The lateral pectoral nerve with C5, C6, C7 as root values supplies the clavicular head, and the medial pectoral nerve with root value C8, T1 supplies the sternocostal head.
Hello friends, the answer for today's MCQ is radial nerve. The picture shows the dorsal part of our hand with different color which has different nerve supply. Radial nerve is one of the major peripheral nerve and one of the long branch of our brachial plexus. As we know, brachial plexus has 4 long branches. They are musculocutaneous nerve, ulnar nerve, medial nerve, and this radial nerve. If we come to the root value of this radial nerve, since it is a terminal continuation of the posterior chord of the brachial plexus, its root value is C5, C6, C7, C8 and T1. The radial nerve terminates by 2 main branches. They are deep branch and superficial branch. Deep branch innervates to the muscles and functions as motor primarily. The superficial branch innervates the skin and functions as sensory primarily. The superficial branch supplies to the lateral 2/3 except the distal phalanges. That means the middle and proximal phalanges. That highlighted portion in this question.
The answer is middle meningeal artery. The point shown in the picture is pterion. Pterion is the thinnest part of the skull where the frontal bone, the parietal bone, the temporal bone and the sphenoid bone meets. The middle meningeal artery goes beneath the point. In this picture, we can see the frontal bone, parietal bone, sphenoid bone and temporal bone. Pterion is the point where all these bones meet. The middle meningeal artery can be seen as ascending just beneath the pterion. In this picture, we can see the fracture of pterion and the rupture of middle meningeal artery causing bleeding into the epidural space, and the bleeding causes hematoma, which is a biconvex shaped hematoma known as epidural hematoma. The surface anatomy of pterion. The pterion lies 4 cm behind the zygomatic suture and 4 cm above the center of the zygomatic arch. It is the common point where these two lines meet. In this picture, the two lines are shown as A and B. The length of A and B is same, that is 4 cm. The fracture of the pterion causes rupture of meningeal artery and bleeding into the epidural space, causing epidural hematoma. The answer is musculocutaneous nerve. As the name depicts, the musculocutaneous nerve supplies both muscle and the cutaneous part. The muscles supplied by the musculocutaneous nerve are biceps brachii, coracobrachialis and the brachialis muscle. The cutaneous supply is for the lateral aspect of forearm. The musculocutaneous nerve is the terminal branch of the lateral cord of the brachial plexus with root values C5, C6 and C7. It emerges at the inferior border of the pectoralis minor muscle and it leaves the axilla, pierces the coracobrachialis muscle. It gives a branch to the biceps brachii muscle, also to the brachialis muscle, and it continues as the lateral antebrachial cutaneous nerve, means the lateral cutaneous nerve which supplies the lateral aspect of forearm. Thus, the musculocutaneous nerve supplies the muscles of the anterior compartment of the arm, that is the coracobrachialis muscle, the biceps brachii muscle and the brachialis muscle. The important point to note here is the musculocutaneous nerve pierces the coracobrachialis muscle.